Okay, I think we'll get started. Thanks for being on, everyone. This week, I think we want to leave as much time as possible for your questions, but wanted to start with Representative Caferro. She has a provider rate bill that's about to drop this week that really addresses the Guidehouse study that we've heard so much about. So I'll kick it to her first, and then wanted to give Pat a chance to talk about what he anticipates on the floor today, and then we'll field your questions. So I'll kick it over to Mary. Mary, you're muted still.
Recording in progress.
All right. Thank you for including me. I will be dropping a bill this week. And what the bill does is, number one, identifies a problem. The problem is that folks are going without the services that they need, and providers are shuttering, discontinuing lines of services and creating all kinds of problems and tragedy in our state. We identify that problem. We come up with the solution, which is to provide a provider rate increase for Medicaid services that's based on data and actually provides the cost of living, the cost of doing business, and then an inflationary factor. And so that's what my bill does. And let's talk about why that's important. So going back, who's the party that's been there for folks? And that is Democrats. Democrats have been there for decades, working hard to provide a rate that makes sense for people so that they can do business and care for others. In the Medicaid system, there are two important parties. The most important is the patients and the workers that care for them. Workers should not have to sacrifice their own economic security and well-being in order to take care of patients. So we support that individuals have the freedom to live in their own community, to be surrounded by what's familiar to them, to be cared for by friends, family, and neighbors. And that's what this bill does. And I'm just going to leave the rest up for questions, if that's all right. I'm not sure how y'all do this, and I don't want to take too much time. So if that's enough to start with, great.
Yeah, that's how we do it. Pat, do you want to talk a little bit about Senate floor today?
Sure, of course. As I think probably all of you know, the Senate's going to be debating Senate Bill 99 today in our floor session. Senate Bill 99 is an attack on the freedoms and privacy of our trans, non-binary, and two-spirit neighbors and friends. Any attack on their rights is clearly an attack on every Montanan's rights. And our Democratic senators today are going to strongly oppose this hateful piece of legislation, as we did in the Judiciary Committee. I got to sit in on the committee hearing for S. Bill 99. It was a 5-hour hearing. And that one thing that stood out for me in that hearing was the bravery of our LGBTQ community. Those Montanans came in and testified and told their story, and it had really a profound impact on me hearing them directly. I was also moved by the joy that many of them showed for their lives once they are recognized for who they are. And that came from the trans community, the non-binary, and the two-spirit Montanans who spoke to the committee. I believe our communities can and should value, foster, and protect that joy in any way we can. Senate Bill 99 is an attempt to take all that away. To Montana's LGBT community, I want to make sure that once again, you know that you are recognized. We stand with you, we love you, and we'll be with you in this fight today.
Thanks, Pat. We can open it up for questions for Mary, for Pat, anything that you guys are interested in this week. If you want to raise, yep. Kayla, go ahead.
Thank you. Thank you for having this this presser. It helps catch up on the Medicaid reimbursement rate question. And so, Mary, will you talk about, sorry, Representative Caferro, will you talk about, as a little reminder, how the match works? Like Montana puts in X amount and then the feds put in X amount, and is there a point where Montana will put in some and it's, you know, it hits a limit? Can you help with that?
Sure, I'd be happy to. To start with, healthcare is the number one industry in the state. And so our bill invests in the number one industry in the state. And what's really amazing about Medicaid is it goes into every community across the state, all four corners and all parts in between, cradle to grave. It supports an industry that is morally driven. And like I said, supports people to have the independence that they deserve to live and be in their communities. What's happened is that the Gianforte administration has ignored the problem that he's become very aware of, and that is that people are not paid enough in order to provide the services. And like I said, Democrats last session, almost at every turn, tried to get those rates, the provider rates, increased, because without providers, people go without services. And we did that last session and also in the interim. Now, remember, this state has more money than we've ever had. There's absolutely no excuse to not address this problem right now. You have to have your head in the sand, like the Gianforte administration does, to ignore the problem of the nursing homes. So 11 have closed already, and I heard that one in Lincoln County is about to close too. This has displaced almost 1,000 people who are elderly. They're vulnerable. Some are suffering from dementia. Many of them have had to be moved hundreds of miles from their home and everything that's familiar to them, including their family. Some have had to move multiple times and given up everything that they know. This leads to a decline in their health and in some cases death. This is absolutely amazing that this administration would not choose to invest in this problem. And going back to the number one industry, an investment of one state dollar into healthcare can draw down, in some cases, 9 federal dollars to every state, and at least 3 to 1. Who wouldn't do that? It's a good bang for the buck, and it improves the health and well-being of people across the state.
Thanks, Mary. Jonathan, we'll go Jonathan, Holly, Blair, then Alex. Jonathan.
Thank you, Representative Caferro. I was wondering if you have any idea of, because my understanding is this you're proposing as a separate bill. Is this something that is going to be, is the proposal for the rate increase that you guys don't think is enough, is that going to be discussed as part of the HB2 discussions? And then what's the thinking of this being a separate bill? If that's the case, what's the thing of this being a separate bill rather than trying to fight it out in the HB2 debate?
Okay, so to start with all due respect, I need to correct you. It isn't that we think this isn't enough, it's that we know it's not enough. The Guidehouse study cost millions of dollars. It provided database, which is exactly what the department said. The department kept saying, no, Democrats, we don't need to do anything about the provider rates. We first need to study it. We first need to study it and then decide what to do, because we want our decisions to be based on data. And then they turned around and ignored the data. They completely ignored it. They provided a 10-foot rope for a 20-foot hole. So that's the beginning. This study shows the cost of doing business in Montana for the number one industry, one that draws down, lots and lots of money. So that's the starting point. And then second, what the bill does is looks at that data and bases the provider rate adjustment on the data. The Gianforte administration is not, they don't do that in House Bill 2. We can have discussions in the subcommittee, we already have, but this bill is necessary. We can't wait for them to do what is essential. We can't let another nursing home close down. We need to do this. We need to make sure that in-home services are provided. People are on waiting lists right now. I don't know if you know this, but 233,000 Montanans have disabilities. And this bill addresses the disability issue and the lack of services. 20,000 kids have disabilities, 20,000 students, K through 12. Well, I'm sure you've heard about the school-based services for children with disabilities and how that's crumbling. Montana has a good, strong infrastructure in our state. We have providers that are dedicated, they're state-based, and they've provided services in some case for 100 years. So we need to invest in those providers so that they can build back that infrastructure necessary to take care of Montanans.
Thank you.
Kelly.
Yeah, thank you guys for doing this call. I think this is probably best directed for Senator Flowers, but if anyone else wants to jump in, I'm wondering what conversations you've had with Republicans across the aisle about Senate Bill 99 and trying to encourage them to oppose it. And then I'm also wondering if you see the Senate as being more willing to maybe vote this down than if it were to get over to the House.
Well, thanks, Holly, for the question. We've had discussions, obviously, with our friends across the aisle, and certainly I think there will be some Republicans who oppose this bill. I think time will tell how many. I am probably not in the, or I'd ask Kim also to weigh in on this, as she has a much better perspective and handle on the House.
Yeah, Holly, I mean, I think we're certainly prepared to oppose this bill should it come over. I think obviously we have two trans members in our caucus who I feel like have built relationships with Republicans over the first 5 weeks of this session, who are incredible messengers for our community. And it's a really mean, harmful piece of legislation. But the LGBT community in Montana is a thriving community that stands up for themselves and each other. And so, should that come across, we'll deal with it over here. And, I'm hopeful that we'll figure out a way to prevent it from getting to the governor's desk.
Awesome. Thank you both.
Yep. Blair.
Yeah, Minority Leader Abbott. I wanted to ask you about House Bill 252 yesterday, the youth suicide prevention, and just your thoughts on that, and if there's any other plans moving forward with that bill or topic.
Yeah, that was a really disappointing result. I think that Representative Carlin did an excellent job in committee, did an excellent job on the floor. I think that's gotten caught up in some frustration around past proposals. I think what we'll try to do is keep that alive, get it down to appropriations, and see if it can be part of the solution moving forward. I think there are a lot of good ideas. Jonathan's bill, was about evidence-based practices. It was optional at every possible point in the road, optional for a school to participate, optional for parents to participate. So I'm hoping that we can have some conversations with Republicans, get that back on second reading and refer it down to approps. But we'll see. We need to, obviously it was a 49-51 squeaker. So.
Well, thanks.
Yep. Alex.
This is for Representative Caferro. I was curious, folks that I've talked to and advocates for a rate increase are saying that the proposed benchmark in the study isn't enough as it stands, and obviously the proposal from the Gianforte administration is below that. So I'm just wondering, what mechanism or what does this bill do to kind of propel it beyond what the proposed benchmark is, and can it increase over time should it pass?
I apologize. You said you've heard from some people?
Yeah. So Rose Hughes, for example, I've interviewed her quite a few times, and she's very concerned that even what's already in the benchmark rate study isn't enough, as well as folks in Gallatin County, specifically the rest home administrator here.
Yeah, so that's a specific issue to the nursing homes, and what happened is the study identified what it costs to do business, and then they provided some discounts, and the discounts don't make sense for Montana. So that's a specific issue to nursing homes. I haven't heard that from anybody else, though, but I will tell you that what the bill does do to try to address costs going forward is puts in an inflationary factor.
Keely, you had your hand up. Did you have a question? I see it's down now. Okay. Kayla, did you have another question? Great.
Yeah, and let's see, back on the Guidehouse study, I've asked the question of DPHHS as well, but I imagine Representative Caferro, you might also have the information. You mentioned in the bill 2.75 million appropriated for the study, but I'm wondering if you know if that's been increased since.
Do you mean if the level of funding paid to Guidehouse has been increased? I think that's a good question for the department. All I know is that in subcommittee, there are there are presentations by Guidehouse, for example, the Medicaid unwind for 303,000 people in Montana have Medicaid currently, and with the ending of the public health emergency, the department is going to need to come up with a system for everyone to get their eligibility redetermined. And Guidehouse did a study or something, I don't know what they did, something on that issue too. So Guidehouse is popping up around the department, and I think that'd be a good question for them. Sorry, I don't know.
Hallie, did you have another question?
I did. I just wanted to ask about Representative Buckley's bill that would offer 12 months of access to birth control. With the vote with that passing second reading on yesterday on the floor. I'm wondering what's different compared to, if I'm understanding this right, if I have it wrong, please let me know, but wasn't that defeated in past sessions? I'm just wondering what was different about what made this year's approach more palatable.
Yeah, you're right. I mean, I know that Representative Bishop introduced the same bill. So at least one time it got introduced and failed. I think Representative Buckley did a great job in the Human Services Committee, sort of building relationships with Republicans. It came out with a really strong vote. In terms of what is different, I think Montanans have made it clear that the right to privacy, the right to reproductive autonomy are central and essential. And I think that a lot of Republicans are feeling the support of voters on issues of reproductive health. Honestly, I mean, I think we saw the November election results sent a clear message.
Awesome. Thank you.
Yep. Mara.
Yeah. Hey, this is a question for Representative Caferro. In the last couple of days in the joint meetings between Section B and Section F, it seems like the department has gotten a couple of tough questions, tough reactions from Republican lawmakers, especially about their projections for long-term investments in behavioral health. And that has made me wonder what the appetite is for a big investment in Medicaid rates, even as is in the department's current request, let alone a bigger request as is outlined in your bill. So I guess I just wonder what the conversations have been with your colleagues across the aisle and in those committees about the interest in increasing Medicaid rates.
Thank you for the question. And I can't speak for the Republicans, but what I will say is that I don't even know what's in the governor's proposal. For Medicaid, for mental health. We don't know. We haven't seen the details, and that's part of the problem. We're going to start voting next week. And my bill doesn't spend more money than what the governor wants, especially for those facilities, for the build for this facilities. Our bill does not spend more money than that. It spends a fraction of that money. Like maybe 10% of what they want. And again, I can't comment on the plan or what Republicans are thinking. I know Republicans are supportive of the Republicans support services being provided in their communities. These businesses are all over the state. Individuals are all over the state. They're in every district. And when you think about a person who has Alzheimer's and they've lived their whole life as a rancher in a very small community, the legislator who represents that community knows what's going on. They probably know the people directly. It's probably happening in their own families. Therefore, I will say that I've heard from many people across the aisle that they support doing something about the problem of Medicaid provider rates so that we can make sure that, gosh, that the community services don't continue to go away.
Just so I understand what you're saying about the difference in spending for the infrastructure as related to an infrastructure expansion, are you saying that your bill wouldn't spend more than what the department is proposing on infrastructural expansion,
Absolutely.
but rather puts that money towards Medicaid rates?
No, I don't know what the fiscal note will be on the bill because, of course, the department writes the fiscal note. But what I do know is in the Guidehouse study, the nursing home study identified 19 million in state funds necessary to bring that rate up, and 29 million a year in state funds for all the other providers that we're talking about. So that's a total of what, 48 million a year in state funds. And if you look on the Section F's, I don't know, House Bill 10 or House Bill 5. Anyway, the bill that Section F is looking at for the governor's proposal, it's, I think, 118 for the buildings, 9, and that's like, I don't know, it's 150 million or more to build facilities. And so there's no comparison. And the other thing I'd say is that when we invest in, talking about suicide prevention, when we invest in these upstream services, the upstream supports, that's where you get the biggest bang for your buck. It's the least expensive and the most effective. That includes in-home services so that seniors can age in their own homes. That includes the services that are prevention services for children who have disabilities. That includes the in-home services for children who have disabilities in the schools. All of that is upstream work, and then that avoids the downstream. And so, yeah, I don't know what the fiscal note is. I just know that we based the bill totally on the Guidehouse study, which is, data driven and cost a lot of money to complete.
Thank you very much.
Kayla, did you have another question?
Yeah, Representative Caferro, you had identified a chunk of money that was in the director's office, the health department director's office, and you had requested some clarity on that. And I am wondering if the department has provided that yet.
The department has not provided clarity on that slush fund for the director.
Thank you.
Anybody else have a question? Kayla, your hand's still up. Did you have another question?
I do. I'm sorry.
Oh, great.
And this is an easy one, and maybe somebody can point me in the right direction. And I asked the department as well. I'm looking for a cheat sheet where I know with the nursing home rates, there's a 58% for the first year and then 38% the second year. But I want to see I want to see the whole list. Is that like a link anybody can quickly send me?
I'll tell you, you and me both.
Thank you.
And this is what I'll say. Just, I really appreciate your interest in this. This is a part of the way the department is rolling out their budget, and it's not transparent and it's not fair. We know those two for sure. And I'll tell you what, just by the way you stated that, it's not 58% of a provider rate increase. What they do is, this is what's currently being paid, and this is what the study identifies as the cost of doing business. It's 58% of that difference. It's not 58% of what they currently get paid. Year one, that 22 million, which draws down a bunch of money, which could be up to, I don't know, 100 million. That is the slush fund that goes into the director's office, and then he's going to dole out, supposedly, the provider rate increases. This is unprecedented. This is not how you do things. We are the appropriators. We are the ones, the legislature appropriates the money. The department is the one that pays the bills. And so this is a complete switch in roles, and it's probably not constitutional. So that's year one, and it's 58% of the difference, not of the provider rate itself. And so I'm trying to get to the bottom of that. I'm trying to get to the bottom of where that money would go, trying to get to the bottom of the 300 million that the governor wants for this mental health redesign. And so far, we don't have the information necessary, and we start executive action next week. So you and me both are in the dark on this one.
Thank you.
Mara.
Yeah, this is a question for Representative Abbott about House Bill 303 yesterday on the floor. Can you talk a little bit about that vote? And I guess just overall, if the result of that bill changes calculations for working with Republicans in the future on bills that you guys would like to not pass, what happened with that vote?
So it doesn't change our approach to working with Republicans to kill bad legislation. On that one, we didn't get there. I thought the strategy to move the amendment was a fair one. I mean, if it's good for the private sector, it should be good for the public sector. I was disappointed that amendment didn't get on. I think the floor debate was a little disappointing to me. The bill is more extreme than any other state in the country because it doesn't require for doctors to tell, or medical providers to tell people in advance that they could deny care. And so you heard Representative Harvey, who's a first responder, talk about his experiences out in the field. And, I wish we would have pulled more Republicans. We didn't. It doesn't change the fact that we'll keep working with them. And, we're here to try to protect our constituents, and we'll continue to do that. Okay. Any last questions?
May I say something?
Yeah.
Thank you for having me, and thank you so much for the interest in Medicaid. I really appreciate it, and all of these other issues that have been covered.
Such a treat to have special guest Representative Caferro. Good to see you all. We'll see you next week. Thanks for being on.
Thanks.
Thank you.
Bye-bye.
Recording.